It was clear that none of us knew anything. Not the tattooed welder, not the nondescript guy, not the college professor, not the guy who vaped in the parking lot when we were on our breaks, not the guy at the Weather Channel. He seemed to actually know what he was doing because his wife was so obsessed with every detail about giving birth that it almost bordered on some kind of a disorder. We had nothing in common. Nothing except that we were all about to become fathers and we were all in the same birthing class. And I think we all kind of saw ourselves as these sort of white, middle class, Paul Rudd, Jason Bateman types who were stuck inside of this romantic comedy. Renee, the doula, she was very, very patient with us. So, once the water breaks, how much time do we have to get to the hospital? Usually, hours. You could watch all of Saving Private Ryan. But there's going to be like a big mess, right? When the water breaks, we're going to need like a towel or a bucket or something, right? Probably not. Now, when I get into the operating room, wait, there's probably not going to be an operating room. If everything goes as planned, your wife's going to give birth in a hospital room. That's when I realized that everything that all the dads knew about childbirth was based on things they had seen in movies. The moms, the partners, they had real questions. Which hospitals had good reputations? What are exercises you can do to help along your progression? What was water birth like? Real questions. One woman asked, "What about emergency C-sections?" And Renee, the doula, said, "People talk to me about discussing having a emergency C-section with their doctor." That's not an emergency C-section. An emergency C-section is when they roll you out of your room and your husband is standing there wondering what happened. That seemed like a great image to me. A father standing there in a hospital room wondering what happened. It seemed to sort of encapsulate how a lot of dads feel about childbirth. For the first 30-ish years of my life, I never paid attention to any information about childbirth because I didn't think I was going to have children. But things change. I changed. I met someone who wanted to have children, and we fell in love. And she made it sound like a good idea. And a big part of that was her. She's a licensed clinical social worker. She had run an early Head Start program that was for moms and kids. She had an infant mental health certificate, and she was an expert in working with kids who had autism. She was the kid whisperer. So even though I didn't know anything about having kids, I figured that she probably knew enough. Once, when we were dating, and it was way too early to have a conversation like this, I arrived at her house and she said to me, "Oh, I had a dream last night that we had a baby." And the baby walked around and swore and wore a big floppy hat and danced like that baby on Ally McBeal. And the baby's name was Hazel. Our friends took us out for spicy Szechuan. By 9 o'clock, the contractions had started. And then the puking. So much puking and puking and puking all the way to the waiting room at the hospital where there was some poor guy who was watching TV trying to pretend like he wasn't looking at the puking, moaning pregnant lady who was barfing into a garbage pail. He was just there to see somebody that he knew. If you're hanging around in downtown Atlanta and the drug deal you're participating in goes wrong and you get shot, the Atlanta Medical Center is probably where they will send you. It's also where our midwives work. We wound up in a triage room, not a real hospital room. The human animal was revealed in front of us. This was not the miracle that Renee the doula had made it seem like it was. All the puking meant fluids. And an IV meant that it was easier to have some pain medication. And some pain medication meant you wind up having an epidural. And a fluctuating heart rate meant you end up taking magnesium sulfate. The magnesium sulfate slows your progression, which means Pitocin, which can have side effects. After we'd been there about a day, we finally got a new doctor who came in to check vitals and to just check in. And she was chatting with us really pleasantly, and then all of a sudden, she started talking to the nurses in another language. I mean, it was English words, but it was hospitalese. And they started talking very quickly, and there was a very loud and scary beeping sound. And they started moving furniture around very, very quickly, and they rolled my wife's bed out into the hallway, and I was left standing there. An emergency C-section is when they roll you out of your room and your husband is left wondering what happened. I ran alongside the bed saying things like, everything's going to be all right. It's going to be okay, even though I had no idea if that was true or not. And I ran with them right up to the 2 double doors that led to the surgery unit. And that's where they told me I had to stay. You've probably heard the saying that there's no atheists in foxholes. I didn't know what to do. And I don't really pray, but finally, after what seemed like an eternity, they told me that I could come in. Everything was fine, but they weren't messing around anymore, and they were going in to get the baby. I went into the operating room, and I found my wife there, splayed out like the crucifixion, with this curtain bisecting her body so that we couldn't see the surgery. Not that that was a problem for her, because she was completely stoned out of her mind. At one point, they asked me if I wanted to look over the curtain and see the baby come out. Huge mistake. Huge. And then I got her, and we did skin to skin. I learned that in birthing class. And everything was okay. Except, sometimes when they rush you in for emergency surgery, they don't take a time to count all the instruments. So the doctor said that they were going to just need a minute to check some things out. And they sent me out in the hallway, and they handed me this baby. This tiny, perfect baby. And I didn't know what to do with a baby. In that moment, and this is true, I thought for the first time in my life, there are circumstances under which I would murder another person. And I'm standing there in a hallway, holding my child, and I looked down at Hazel and I said to her, "Hi, I'm your dad, and I'm going to take care of you." Over in another surgery room, there was a woman cleaning, and she had a radio on her cleaning cart. And she was singing to the radio at the top of her lungs, "If you like it, then you should have put a ring on it. Dubba 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 ring on it. Oh 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 oh." And I said to Hazel, "Do you hear that? That's Beyonce. She's our leader." And I guess I knew what to do after all.